Yes, I was concerned. Very, very. I was afraid, to be honest with you, because you can't see it.
The Midland International Airport and Spaceport becomes the scene of an Ebola scare overnight. Hello, good morning. Thank you so much for joining us. We begin this morning with team coverage in a scare that left 69 passengers on an American Eagle flight concerned. CBS 7's Matt Rist was the first on the scene. He joins us live where officials now say the female patient likely does not have Ebola. Matt, what can you tell us?
Krista, Midland City officials tell me that the passenger was vomiting on the plane before it landed here at Midland International Airport. It was enough to put local paramedics on edge. They were discussing Ebola-like symptoms here at the scene when the plane landed. Take a look. The plane behind me, everything's calmed down. Now Midland City officials are saying that this female passenger on the plane likely does not have Ebola, but the whole scare was enough to put the 68 other passengers on board on edge. Emergency personnel and a hazmat triage greeted American Eagle Flight 2791 at Midland International Airport. Paramedics on scene discussed Ebola-like symptoms for one passenger who was vomiting on the plane.
They said flu-like symptoms. Somewhere along the way, the word Ebola came out. And so you can imagine with the publicity that has been surrounding Ebola right now, that's something that people aren't taking very lightly. The fact that the passenger didn't even have a fever was something that was a very good sign to us.
Just before landing, passengers were given masks.
Well, they only told us that that somebody was sick, but we didn't know that it was someone on the plane until we started seeing people or men in hazmats getting ready to come into the plane, and then they took a woman out.
The sick transported to Midland Memorial Hospital. Paramedics used hazmat and infection control procedures in transport.
Yes, I was concerned. Very, very. I was afraid, to be honest with you, because you can't see it, you know.
Yes, I was kind of scared for my family. I didn't want to take it home to my wife or my kids or my brother, anybody.
By 12:30, the passengers were all released. Midland City officials confirmed the sick patient came from Istanbul, Turkey, where no cases of Ebola are reported.
No, not having a fever was an indication that this probably isn't Ebola.
Now, Krista, the passengers here waited inside the plane on the tarmac for about an hour and a half. I wanted to take you inside, show you the scene. Here's a picture provided to me by one of the passengers. I'm told that hazmat crews were on the plane after they had landed. They also distributed these masks that folks wanted to wear. Now, Krista, what's next for these passengers? Many of these are Midlanders or who live and work here in Midland. Well, the city says they're going to be closely monitoring their status. Now, if any patients, any of the folks on this flight see any flu-like symptoms in the coming weeks, they need to contact a health official immediately or even the airport. Now, we're going to continue to track this story throughout the morning show as any developments come up. As you can see behind me, things running smoothly here at Midland International Airport after what was a very traumatic Ebola scare. For now, I'm live in Midland. Matt Rist, CBS 7 News.
Thank you very much, Matt, for that report. Now we continue our team coverage at Midland Memorial Hospital where the patient was transported. Tatum Gwynn is standing by to give us a look at the scene. Good morning, Tatum.
We do know that a patient on flight 2791 from Dallas was transported here to the hospital experiencing some symptoms while on the plane. This person has been vomiting but no fever. Ebola has not been ruled out, but city officials say that it is not likely. Now, we have been here at the hospital for several hours, and when we got here, there was a hazmat truck, which is still here, and an ambulance that was at the front entrance of the emergency room. There was a Midland patrol car that was blocking the back entrance to the emergency room, just in case for whatever might have happened. Again, everything looks to be wrapping up, which is good news. For now, reporting in Midland, I'm Tatum Gwynn, CBS 7 News.
Thank you very much, Tatum, for that report. Now, the Midland Independent School District is changing policy to help prevent the spread of the Ebola virus. The school will now be asking incoming students about their travel history. It's all part of guidelines sent down from the Texas School Nurse Association.
Where have they traveled? If they've been in contact with anybody who has been ill, or if they've been a care provider for the person that's been ill. And we're primarily interested in people who have traveled to West Africa. We want to be proactive and make sure that if people are enrolling in our schools that they're healthy.
ECISD said that it is expected to make similar policy changes soon. Meanwhile, the Dallas hospital treating the first case of Ebola diagnosed in the U.S. says Thomas Eric Duncan is breathing on a ventilator and is undergoing kidney dialysis. His estranged son, Eric, paid a visit to the hospital, thanking the facility for helping his father stay alive. Duncan is in critical but stable condition and is receiving an experimental drug, the same drug being given to TV cameraman Ashoka Mukpo at a Nebraska hospital. Over in Dallas, 5 sheriff's deputies' vehicles underwent decontamination Tuesday after possible exposure to the Ebola virus. Now, crews in hazmat gear could be seen sanitizing their vehicles. The cruisers have been parked since deputies went into the apartment where Ebola patient Thomas Eric Duncan was staying. None of them wore protective gear. No word on the health of the officers who drove the vehicle. As we continue to cover this story, Dr. Sudip Bose joins us this morning to speak about the virus and hopefully ease some of our concerns. Dr. Bose, what do we need to be worried about at this point?
Good morning. So Ebola currently is a disease of Africa, and that's important to remember. I mean, the geography is an important factor here, and normally you have to be back from Africa within 21 days to catch this. That just goes along with the incubation period of the virus. So, for example, if someone comes back from Africa 60 days later, this is not Ebola. And you can't catch Ebola by, being coughed on or sneezed on or through food. This is through bodily secretions. So, exposure to vomit, exposure to diarrhea, and exposure to, healthcare workers are at risk, exposure to blood, sharing needles also. And the reason this is getting so much press is just, if you do catch this, it is very dangerous. Vomiting, diarrhea, fever, weakness, and these go along with many other, illnesses which are not Ebola. But Ebola is separate because there's bleeding from the orifices as well. And so the key point I'm making here is, you have to have contact with someone from Africa to get this, and you have to be symptomatic to pass it on. So, for example, if you went to Africa and I were in contact with you, but you never got sick, and then I get sick, it's not Ebola. So in order to pass it on, someone has to have symptoms, the symptoms I just discussed, like vomiting, diarrhea, fever, things like that. So I think it's important to just recall these things, and I think it's good that we have, the media and, interviews like this and, broadcasts like this to make people more aware that it is out there. Because if you think about it, centuries ago when populations were wiped out from the plague, or, in 1918 when there was a big flu epidemic, hundreds and thousands of people died because of lack of knowledge. So it's great we have the media for the knowledge at this point, but we have to use this knowledge responsibly and not overreact and just be aware.
Right. Now, Dr. Bose, I know that you mentioned that a lot of these symptoms are similar to the flu. As a parent and being concerned about this, is there a test that can be done to differentiate between the two, just in case, you do start to see those symptoms and you are worried?
Yeah, I mean, in general right now, if somebody comes in with fevers, vomiting, diarrhea, and some of these symptoms, they are not going to be tested for Ebola. And unless there are those risk factors we talked about, which is recent trip to Africa within 21 days, or in contact with someone who recently went to Africa and had symptoms.
Right.
So in general, if you are one of those people who have those two situations, contact the CDC. And I think it starts from just telling the doctor your travel history as well. A lot of times, this is left out of the history, so it's important to mention the travel history. But the bigger picture here is, I think, when we hear hoofbeats, we have to think of horses, not zebras. And, we are all concerned about Ebola, and it's great, with media broadcasts like this that, the CDC, the World Health Organization, airports, myself in the front lines of the emergency room, the public can be aware it's existing. But I think we're missing the big picture here. I mean, there are up to 50,000 people dying every year from the flu, and we're not getting our flu vaccines. And by not getting certain vaccines, we're seeing emergences of diseases such as measles and whooping cough, which should be pretty much eradicated. And, we're forgetting basic things like washing our hands and not telling the doctor travel history. So let's start with the basics. Let's not overreact to zebras. When we hear hoofbeats, let's worry about the horses, and we have bigger fish to fry at this point. So I think that's the important thing to remember, not to panic.
Great. That is great advice, Dr. Bose.
We cover a lot of these other topics we discussed on Wednesday afternoons with Robert Guadarrama on our weekly health segments. So, and if you're missing those, you can, catch some of the older segments on, my Facebook page, Dr. Sudeep Bose, or keepyourinnerarmystrong.com, because our health is our inner army. So I think it's important to stay knowledgeable, but not to overreact when things like this happen.
Great advice. Thank you so much for joining us live from Los Angeles this morning, Dr. Bose. I think that was a great analogy, something we can all take heed in, and we appreciate you. Thank you so much.